the work that you do with the hospitals across Africa and also in Haiti, what would you say are the most pressing challenges that you come across?
Many of these countries have talented healthcare workers who have been trained, doctors and nurses who know what to do, but they're missing some of the most fundamentals. Even with hospital beds. In many countries, up to 20% of people sleep on the floor on a mat or on beds where the mattress is missing and they use cardboard to make a makeshift mattress. You see conditions where there's no electricity in many of the hospitals. It could be 90 degrees on the ward with 95% humidity. There's no electricity, there's nothing for people to do, and that's just the comfort care. Then if people need surgery, there are often no supplies for emergency surgery. So there's a tremendous need for health care, beginning with supplies and infrastructure.
Right, and where does your organization come in? I mean, you obviously want to gather as many supplies as you can from hospitals around the United States. How do you begin to do that?
Well, we've been networking across the United States and reaching out to hospitals. We have two types of programs. One is a recycling bin in operating rooms for supplies that are every day thrown out at the end of a procedure. We also try and reach out to hospitals at the time of their upgrade or replacement of capital equipment to send us their equipment, and we pay for it to be picked up. But if a hospital is going to replace the sonogram machine they have for the next model, we want it, or hospital beds, or an x-ray machine. So we need hospitals to be aware of us so that when they're going to replace an old machine, we want to know about it so we can come and pick up the old one.
Right, and what kinds of supplies are most sought after across Africa?
Well, obviously, we collect everything, but the most pressing needs are probably those supplies that are related to maternal care and to neonatal care. I mean, there's been an ongoing population explosion in Africa, and in this contemporary baby boom, there's a need for delivery tables, a big need for that. Often women are delivering on the floor because they don't have enough delivery tables. Incubators for the babies, sonogram machines. So I would say that if a hospital could focus on any one area, it would be on pediatrics and maternal care. Part of the issue is that the maternal death rate is unacceptably high in the developing world, particularly in Africa, where it's 100 times higher than in the United States. And I think that looking at infant care and maternal care, you see one of the greatest opportunities to help.
Okay, Bruce Charish, thank you very much for joining us.
Thank you for having me.